The Ballinger Eminent Persons Lecture Series at Mott Community College brings prominent individuals to our community to lecture on topics of social, cultural, economic, scientific, and historical significance. It is named in honor of William S. Ballinger Sr. Mr. Ballinger believed strongly in the value of education and of having a resource like Mott Community College available to all. His endowed gift to the college is what makes the Ballinger Eminent Persons Lecture Series possible. The series was created to enhance educational opportunities for Mott Community College students, as well as create an opportunity for public discussion of issues facing the greater Flint and Genesee County community. Since its inception in 1955, speakers have included national and international thought leaders and influencers such as rocket scientist Wernher von Braun, journalist Alistair Cook, Peter Jennings, Leslie Stahl, and John Quinones. Art critic Stanley Kaufman, talk show host Geraldo Rivera, writers including Alex Haley and William Buckley, author Stephanie Land, American geographer Jared Diamond, humorist Art Buchwald, activists such as Julian Bond, Jesse Jackson, Morris Dees, and Cesar Chavez. Activist and actor Harry Belafonte. Director Spike Lee. Actress Jennifer Lewis. Actor Ernie Hudson. Film producer Kathleen Glenn. Businessman and Shark Tank star Damon John. Politicians including former Governor John Engler, former Prime Minister of Poland Lech Walesa, and the former Prime Minister of Great Britain Harold Wilson. Musicians such as Dizzy Gillespie, Stan Kenton, Ramsey Lewis, and Patti Smith. Poet Allen Ginsberg. Mental health advocate and actor Sean Astin. Former Surgeon General Dr. David Satcher. And famed anthropologist Margaret Mead. This tradition of excellence continues with today's presentation, and each of you is a part of this ongoing tradition.
Well, good afternoon, everyone. My name is Dr. Kenyatta Dodson. I represent the Mott Community College Board of Trustees. On behalf of our trustees, I want to say thank you for being here for this speaker series. And what better speaker series than to have Dr. Bobby McCullough. I see that our president is here. President Shonda, if you could just stand and do a wave. I also see that there are one or more of the trustees that are here. Could you stand to be recognized? Yay. 'Cause 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 'c If there are any other elected officials in the room, could you just stand just to be recognized as well? And you followed the assignment you have on green. Yay. So thank you so very much. We know that you are going to enjoy this conversation. And from here, I'll turn it over to Mr. Bill.
Thank you, Kenyatta. Ladies and gentlemen, first I want to note that we once again have a moderator facilitator, Jim Kurtzner, who is a veteran Emmy Award-winning TV news investigative reporter here in Flint, mid-Michigan, and Detroit, with 42 years of experience. You'll hear from Jim later this evening. But now, without further ado, I want to introduce our star of the evening, our local boy made good, Dr. Bobby McCamala, or, since it's St. Patrick's Day, maybe it's Bobby O. McCamala, or Mick McCamala, whatever. As we all know, the doctor has ascended to the presidency of the American Medical Association, the AMA, the nation's largest physician organization. He's a board-certified, this is a big word now, otolaryngologist, which is a head and neck surgeon. He is a graduate of the University of Michigan Medical School, who remains deeply rooted in his hometown of Flint, where he maintains a private practice and has been a leading voice in public health. Before his leadership roles at the AMA, Dr. McCamala has served as a member of the Michigan State Medical Society Board of Directors since 2011, as board chair for 2 years, and as its president. He's also a past president of the Genesee County Medical Society and continues to serve on that society's board of directors. In addition to his clinical work, Dr. Bobby serves as a trustee of the C.S. Mott Foundation and is a past chair of the Community Foundation of Greater Flint. Today, he shares an office with his wife, Nita Kulkarni, MD, an obstetrician, gynecologist. Together, they have been part of the city's revitalization, including demonstrating their dedication to Flint by establishing the Endowed Health Professions Scholarships at the University of Michigan Flint way back in 2012. Outside of medicine, Dr. McCamala enjoys tinkering with his well-known car collection and spending time with family that includes his twin sons, Devin, a PhD candidate in political philosophy at Duke University, and Nikhil, a biomedical engineer. We are honored to welcome Dr. McCamala to the Ballinger Series. His journey from a local practitioner to the head of the nation's largest physician organization is a testament not only to his brilliance, but his dedication. This conversation with him tonight offers a unique opportunity for our community to hear from a national leader who truly understands the heartbeat of Flint. Ladies and gentlemen, I give you Dr. Bobby McCamala.
Well, that was pretty cool. You know, I spend 200 days this year on the road. I'm traveling across this country and sometimes internationally. and I got to bring that guy with me to introduce me at these things. That was pretty cool. But thank you for that introduction. It is awesome being here at home, having this conversation with you guys. I mean, you'll see I reference our community in many ways, but it's always the center of my conversation about healthcare in this country, because what happens here happens everywhere. Sometimes there's a buffer, and the places that experience what we experience sort of have a cushion to protect them, but eventually it has a ripple effect across this country. And so it's wonderful to be able to talk about our community in so many ways when I give this presentation. I can't lie and tell you that when I pull into this parking lot, I have PTSD a little bit, because I do that a lot to run 5Ks from this place. Like, I think they're running one today, and I'm not a big running fan. I do it to stay fit. So yes, when I pulled into the parking lot, I'm like, oh boy, where's my number? I gotta get my shorts on and run another 5K. But, you know, my office, the one I share with Nita, the OBGYN that you just heard about, is just a few miles from here. And yet, it is demonstrative of the healthcare in this country in so many ways. And I see the flaws in our healthcare system. I started to see this when we started our practice. It's not something we learn in medical school, where we kind of stick to the science, or we used to stick to the science. But then when you start to practice medicine, and you see all the barriers to do what we know that our patients need, but the hassle factor of trying to navigate that system is a problem. And it fails us in many ways. It's amazing in many ways, but it fails us in so many ways, despite the fact that we spend so much on healthcare in this country. And so that's something that motivated me to help protect the healthcare in our country, to protect it for our neighbors, to make sure they can get the quality of care they need from physicians that are available to help them with that, to improve the health of our country. And so it's that reality that made me sort of focus on what it takes to fix this healthcare system, to build stronger, healthier communities in our country. And that's why I feel that this platform that I happen to have this year as the president of the American Medical Association is to share my experiences here in Flint with the rest of the country and with the rest of the world, to face these challenges that we're facing in our practices to deliver that care, and that we as patients are facing in this country, to get healthier, to become healthier, and to navigate a system that is just ridiculously complex in ways that it shouldn't be. And so in my presentation today, I'm going to talk a little bit more about me. That's a standard line in my introduction. It feels really goofy to say that to you guys, because at least half the people in this audience know just about as much about me as they need to know to be able to give the same speech about, yeah, we know that guy, he did this, this is what he does. But thanks for tolerating that again as I talk about it. And I'm going to highlight, obviously, the role of the American Medical Association and what our priorities are, and why it is that we have those priorities to improve the healthcare in our country. So a lot of this, again, you guys know it better than anybody, but currently obviously serving as president of the American Medical Association, board certified in otolaryngology, University of Michigan Medical School. That's a funny story, because you know, my parents, they moved here as immigrants, and I'll tell you a little bit more about them shortly, and they didn't give me any other choice except to go to medical school, right? I literally got grounded when I was a junior at Powers Catholic High School, and I couldn't go to homecoming, couldn't go to Sadie's until I told them that I was gonna, yes, become a doctor. And they're like, fine, now you can leave the house. But that's literally, it sounds like an exaggeration, but that's pretty much exactly what it was like when I got into one of the 7-year programs at the University of Michigan, where Nita and I met, and the rest is history for Nita and I. Did my residency at Loyola, and this was another interesting experience where, you know, the competitive residencies, the ones that are kind of hard to match in, whereas it used to be an early match, where just in case you didn't get in, you could change your mind and do something in the regular match. And ENT was one of those early matches. But there wasn't a couples match, so there was a chance that Nita and I could end up in New York and California, right? And so we got engaged, understanding that we might get split up here. But we both ended up matching in Chicago, and I was at Loyola, and Nita was at Rush. And then 5 years later, you know, Nita was pregnant with our twins, and we decided to come back home. Nita's from Southeast Michigan in Utica, but now Flint is home for us and for her parents and my parents still. So it's wonderful to come back. One of the things that I did at the American Medical Association before joining the board is, you know, in this country we have an issue with abused drugs, right? Deaths associated with opioids. And this was something that we really needed to focus on. We were losing more than 110,000 people a year from overdose. And the consequence of that was everything became more difficult to prescribe, because people start on opioids usually with a prescription, but then end up addicted, 5% of them, and end up using something else. The consequence of that is that when you cut down on the amount of that that's used for good reason, there are some people that have pain issues that still have trouble getting access to the medicines they need to take care of their chronic pain issue. So it's like robbing from Peter to pay Paul. Right? And so that's something that we needed to pay attention to. So we started at the American Medical Association, the Opioid Task Force, which was about prescribing less, and the Pain Care Task Force, which is making sure that patients got what they needed. But to do that in two different rooms at two different times was kind of illogical, right? One should engage with the other. So then they merged them, and that's when I became chair. It's a little weird to be an otolaryngologist, an ENT doctor, chairing the national organization about substance use disorder and opioids, right? I'm not a pain care doctor. So how did that happen? I have a bad habit of not just saying something that's my line in a speech, but instead learning about that topic so I can make sure that I'm not saying something as a speech person, but actually somebody that's done it. So I signed up to get board certified or get what's called an X waiver to prescribe a medicine called buprenorphine, right? Which is what people use when they're trying to get off the medicine that they're addicted to, or the opioid that they're addicted to. So I got my X waiver to prescribe buprenorphine, which is pretty weird for an ENT doc to get it, but I wanted to do it, so when I talked about it in my speeches, I knew what it was like to tell people to also take these same CME hours, right, on the computer. The AMA finds out, and I thought, oh man, I'm gonna get scolded for doing something that's non-traditional, and they were actually kind of excited. Because if we're going to deal with 100,000 people in our country dying from an overdose, it shouldn't require referral to a psychologist or a psychiatrist or an expert in that. It should be something that we all have some basic understanding of how to deal with in our communities, as the physicians in those communities. So they thought it was kind of cool that a non-pain doctor, an ENT doc, got their X waiver. So I started to chair that committee, not because I'm an expert in it, but it demonstrates what it's like when the entire physician community, when the entire healthcare community, the entire community as a whole starts to deal with difficult problems like this. So that's just a little story about how I became the chair of that task force. And then, as you heard, I'm past president of the Michigan State Medical Society, and now honored to serve as a trustee of the Charles Stewart Mott Foundation. And again, when I say this around the country, everyone's like, who's that? Everybody in this room knows who the Mott Foundation is. But what I really like to mention about that when I talk about this to the rest of the world, or the rest of the country, is the importance of people thinking early on about what they want the community to do, the direction they want the community to go in, the direction they want the country to go in. And Charles Stewart Mott was one of those people. And again, I'm not going to dive into that because you all know that, but we are here in this community despite General Motors shrinking in our community and from 80,000 jobs to 8,000 jobs, yet we still exist. We are able to have this conversation in this room on this campus because of that sort of vision, and so for that I'm very thankful. So I'm going to talk now about my path, about how I got to this position in a little bit more detail, because it really informs me about why it is that I'm thinking this way about the healthcare system that we live in. And so these are my parents' villages that they grew up in India. So the top left one there is my dad's home, where he grew up with 9 siblings. One of them passed away early on, and so 4 brothers and 4 sisters in this little house, basically a village in India. His dad worked for a farmer and did that kind of work, and yet my dad managed to get sent to medical school and end up in this country. His younger brother is a dentist, doing very well in India, taking care of that need in his own community. The one on the bottom is my mom's town, a little bit fancier, but not by much. This is where my parents were raised. And this picture that you see on the right is obviously the Lincoln Memorial. So this is when my parents first came to this country at the age of 25. And my mom, she looks a little bigger than she usually is in this picture, but that's because she's pregnant with me. And a few months later, I was born in Pittsburgh when my dad thought he wanted to be a general surgeon, and he started his residency there, and it took him all of about a month to decide, this ain't for me. So then he ended up switching to radiology, and so he did his residency here at Hurley Hospital, and my mom did the same, and this is where I grew up. And so this is where it goes back to their villages, and yet here they are as international medical graduates in this country, being very grateful for having the ability to serve this community and this country as its physicians, but also helping a community that was very short and continues to be very short on U.S. graduates to take care of the people in our community. But there's also some other aspects of this story that I tell. One of them was that when my mom and dad finished their residency in 1975, they decided to move to Grand Blanc, right? I literally grew up in an apartment that's just in the shadow of Hurley Hospital. And then when they graduated, they wanted to go to where a lot of white-collar people in this community go. They moved to the southern suburbs. They moved to Grand Blanc. The problem was that one of my dad's best friends, and many of this room probably recognize this name, Sam Dismond, is an internal medicine doctor that has since passed away and retired and then passed away. Dr. Dismond is black. He was not allowed to move to Grand Blanc, right? So my parents moved to Kings Point, this neighborhood in Grand Blanc. Dr. Dismond had to go to the north side of Flint, where if you were a professional, but a black professional, that's where you ended up. And so here we were in 1975. My parents got to be the first non-white family in Kings Point, right? Or one of the first. But Dr. Dismond was not allowed to do that. That's a problem that affects the future of healthcare in our country, right? When we have that kind of barrier, to have that level of knowledge and education to take care of the people in your community, but you can only live in a particular part of that community, that's a problem, right? And this wasn't the 1940s or 1950s, this is 1975. Now fast forward a little more than another decade, so 1987, my senior year in high school, my parents sell that home in Kings Point to the first black family. And we got death threats in 1987 for doing that, right? Again, not the 1950s, not the 1960s, but 1987, right? And so this is just to demonstrate the consequences of that kind of culture on everything, but as it relates to me and my thoughts about healthcare in this country, to the health of the community, that's a problem, right? And so these are the kind of things that I use these slides for when I travel the country, talking about what needs to be improved. So these are some funny pictures I found this morning. So this is my family in the parking lot of Vincent Court Apartments. You guys might not have heard about that, but it's basically in the shadow of Hurley Hospital, like a few thousand feet. And this is where my parents would do their residency, and so this was a wonderful place to grow up. And I still drive by periodically to see where our apartment is. This is my mom in a picture she used to always take with the patients that she would take care of as a pediatrician in Grand Blanc off Holly Road over there. And this is my dad when he was the chair of the Department of Radiology at Hurley. But this is all just to kind of talk about how at the age of 25, they come here barely knowing anybody. And they delivered health care. They benefited from having this profession in this country that they grew to love and navigated it in this way. This is actually my dad starting to get involved in politics with, I think at that time, in the Congressman Regal and then eventually Senator Regal at their home. And so these are the seeds that my parents planted in my mind about how to be involved in this community, not just taking care of our patients, but beyond that. But what I will confess is that despite that amazing influence, I was an apathetic kid, right? Like I said, I wanted to be Peter Jennings. You saw him as one of the previous speakers there. Because back then, before the internet and 24-hour news like CNN, we would have dinner, we would watch national news on TV. And Peter Jennings was who we would always watch. I was like, I want to be like that guy. Again, my parents grounded me until I changed my mind. And so I went to medical school because they didn't give me a choice, right? And back then, we got into one of those 7-year programs where you're guaranteed admission. They only take like 45 people a year, and it would be foolish to get into medical school when you're a senior in high school and not take advantage of it. So I was like, fine, Mom and Dad, I'll go. You keep giving me my allowance so I have a little bit of money to enjoy college, and I'll become a doctor. I was just apathetic. What's amazing is now I travel the country, just like I talked to students just before I came in here. There's some of them right there. And I see the students that spend time after class learning about a healthcare system that they're going to be working in because they're interested in more than just the science, right? We all need to know the science, but to know how the system works, how do we take good care of our patients navigating the system, is something that I could care less about. I was a lazy, apathetic student. In fact, another funny story, M4 year, right? When you apply to residency, you travel the country, you go to these interviews. So I go to my interview at Mount Sinai Hospital in New York City, and I'm sitting across the table with a guy. His badge happens to say University of Michigan Medical School. Mine says University of Michigan Medical School. We're in the same class. He's seeing me for the first time because I hardly ever went to class, right? Literally. Like, I'm meeting somebody 4 years into my medical school years because I would always just use the scribe notes and study at home. That's how apathetic I was. And this is a confession, right? And yes, I say this all over the country, but this is a confession because I didn't know and I didn't have the passion for the system that we navigate to take care of patients, right? I just needed the science so I could get good grades, so my parents could still give me an allowance and I could go on from there. But I would say that I was a late bloomer, right? So I got involved, and many of you know that, you heard the list of things that I work on in this community to try to improve the health of our community. This is actually, it's just a picture I like, the 9/11 memorial on the first anniversary when our kids, who are now 25, were 2 years old. But it's just a picture that reminds me that my goal, our goals, should be to always leave things better than we found it, right, for that next generation. Personally, I want to leave a healthcare system to the next generation of healthcare workers in this country, doctors in this country, patients in this country, to not inherit something that is a step backwards, but instead actually is a step forward to improve the health of our country. This is me vaccinating Lieutenant Governor Garland Gilchrist when there was 50% of the people that wanted COVID vaccines would line up in the parking lot. I remember going to Bishop Airport and Northwestern High School and vaccinating 1,000 people a day for COVID. And we got to about 50-some%, and the other 40-some% were like, I'm not so sure about that. And so one of my good friends was a guy that my friends and I started a bunch of restaurants in downtown. You guys probably know a little bit about this and me also. But Good Boy Clothing was a clothing store of a good friend of mine, Oakland Mixon. And he ended up passing away from COVID, right? Young black man who had some concerns about COVID vaccination. And he saw me vaccinating. There was a hip hop concert in downtown, so I was vaccinating anybody that was interested. And he watched me do it, and we had this long conversation. And he asked me a lot of questions. I answered them, and I was like, okay, Oakland, you ready to get vaccinated? He said, well, I'll think about it. I'll let you know. I was like, no problem. Call me when you're ready. 3 months later, died of COVID, right? So this is something that is important to me, to leave this world better than we found it by sharing the knowledge that we learn about the science, listening to the social consequences of something like COVID or any disease for that matter, and being able to help people navigate by informing them. None of this should be forced, or it can be forced on people. It just shouldn't be, but it happens with conversation. And so the goal is, again, to leave the world better than we found it. So then, when I took off the hat of being a physician and put on the hat of being a patient. So many of the people, if not all the people in this room, know this has happened because you all have helped me navigate this. But I was giving a speech like this in Orlando for the American Medical Association. It was kind of an internal group, people that had known me for years and elected me to the board. They've heard me speak before, good enough that they voted for me. I'm at the microphone one day, and all of the words just started to come out goofy. Like in the middle of my sentence, I was like, well, yeah, in a bit, something like that, for about 60 seconds. I was 53 at the time. You guys know this term. It's not a professional term, but they call it a brain fart. I thought I had a brain fart. Turns out it wasn't that. After going through all the testing, it turns out it's this brain tumor. You don't need any medical background or anatomy background to look at that picture on the left there and see what doesn't belong, right? So there's this big 8-centimeter brain tumor that was discovered. And it turns out that, I ended up having amazing access to the healthcare system. Literally within hours of having this diagnosis, had a plan, had the names of half a dozen neurosurgeons in this country that are the experts in doing exactly this kind of tumor. Not neurosurgeons in general, but specific neurosurgeons that work on exactly this kind of tumor. That is amazing access. And what I realized immediately, you would think that after this kind of diagnosis and getting the scan, Yeah, I freaked out for a few hours. But then realizing the access that I had, that the rest of our country doesn't have, and I was president-elect of the American Medical Association. They had already voted for me. So I knew that in 6 months I'm going to be inaugurated as the president of the AMA, and now here I am navigating a healthcare system with a life-threatening brain tumor and having this experience that should inform the leadership that I have at the American Medical Association. I couldn't ask for better preparation for this job than having this, right? And it seems goofy to be thankful to have something like this. But, my parents obviously moved here from India. I went to Catholic school pretty much my whole life, starting at Holy Family, then Powers. So Monday through Friday, praying to Jesus. Sundays, praying to Krishna. I was just a happily confused kid, right? Like, I don't know what's going on up there, but I pray to both of you guys. But now I realize that somebody up there had a plan, right? Saying something like, you know what, I know you're going to be president of the largest physicians organization in this country. You're going to be the face of the American Medical Association. You have more experience than anybody being a doctor for 20-some years. You are the person for that. That's why they voted for you. But I'm going to push you a little harder. I'm going to make you turn into a patient, navigating the exact system that you're trying to protect and grow and make sure is there, so you know what it's like from that perspective. And that was amazing, right? Because we know what it's like. I mean, nobody's closer to a patient than their doctor, right? When somebody comes in to see me and they've got an issue, it's not the insurance company, it's not some MBA somewhere that the pharmaceutical company that decides if they're going to have coverage for this drug or not. It's not them that's closer. Nobody's closer than us. But then when you become a patient, you know even more about it. And that's been amazing preparation. And so instead of being private about that, because you know how it is, like something like that happens, and it's totally okay. It's totally legitimate to say, you know what, I just don't want to have to deal with talking about this. I'm going to keep it private. We're just going to keep it in our family. I totally understand that. And for various reasons, one of which was just the simplest thing, like I didn't want people to have that conversation in this community. There's like, did you hear about Bobby Mukamwa? He's got a brain tumor. What? He's got a brain tumor? Like have it be that kind of like rumor as opposed to being on ABC 12 and just telling my community, this is what I got, right? So partly it was that, but partly it was to have a voice so that people that are involved in the healthcare system, now that they see that the American Medical Association president is navigating the system, will ask me questions about what is it that we need to do to make it better, right? It gives me a legitimate stage to stand on, not just as the president of the AMA as a physician, but being a patient in this community. And so it was a wake-up call, right? And at the same time, it was a call to action. Not just being aware of it, but having a platform to help improve these things, about having the means, the access, and the resources to get the best quality of care. Big-time barriers. I know that where I live off Miller Road, that I have this access at 1810 Overhill Drive. If I lived in any direction, 100 feet, that person wouldn't have this access, let alone across the street, right, where it's not quite as nice a neighborhood with the history that our neighborhood has off Miller Road over there. It's an impossible system to navigate, right, with healthcare, medical care being the #1 cause of bankruptcy in this country. That's the system. And so it's been great prep for that. And so this presidency that I have of the American Medical Association is very much focused on trying to improve those barriers that we have. And so we know that there's a lot weighing on our healthcare system, not just from the patient perspective, but the doctors that need to take care of those patients, right? You saw the pictures of my mom and dad. Those smiles weren't just posing pictures, right? My mom loved her practice. She practiced, my dad practiced until they couldn't physically practice anymore. Now, all of my friends in healthcare are planning on retiring at the age of 60. It's not 65, it's not 70, it's not 75 like my parents were. And that's not because of laziness. It's not because of a lack of passion to take care of their patients. It's all of the headwinds that we face, knowing the right thing to do for our patients, but then the problems like prior authorization, the cost of care, it being the #1 cause of bankruptcy, the stress of, the compensation that we get from plans like Medicare that should at least keep up with expenses that are falling so far behind that the expenses of taking care of our patients goes up, but the compensation from the insurance companies don't. right? So the microscope that I use in my office, being an ear guy, this isn't something that I found just a few years ago at some amazing show where they're selling the most amazing type of equipment to us. I found mine not on Facebook Marketplace, which is where a lot of people find their stuff now, not on eBay, which was what they happened before Facebook Market, not on Craigslist, which was even before eBay, in the paper classified ads outside Chicago. The Zeiss microscope. I still have that microscope. Not because there's not better stuff out there, but to kind of figure out a way to invest another $5,000 to $10,000 in a piece of equipment when we're paying our office staff more as they deserve because hourly payment goes up, right? That's just our economics, right? When we started, our staff used to make $10 an hour. Now it's about $20 an hour. But yet the compensation for providing that care has never kept up. So these are the kind of things that the American Medical Association is working on to build that better healthcare system. But why do we need to build it? These are two graphs. You don't need to worry about the letters and the numbers. But this is us compared to other developed countries on our planet, right? So not to a third world country, but other developed countries, Germany, France, the UK. And so that on the upper left there, you see what most of those countries spend on healthcare and how it's changed over the course of the past few decades. And then you see us as an outlier on top. That's what we spend. And this is not dollar amount. This is percentage of GDP. So it's comparable. We spend twice as much as any other developed country on this planet. And then you go to the bottom right, and these are the measurements of our healthcare system performance. How are we doing? Right? How do people manage disease? How well do we prevent disease? And we're an outlier, not in a good way. Right? You see that bottom right, that little dot, that's the United States. So we spend twice as much as anybody, and we are the bottom performer of the top 13 countries on this world. Right? That's a problem. That's a failure. And so these are the kind of things that we need to work on, and why I love taking the microphone to anybody that's willing to listen, particularly those in charge. Right? Whether that's the head of another corporation entity that adds to this cost, whether it's our lawmakers that have the ability to fix this gap that we have. And so, one of the things I'll also mention as an example of where we need to improve. So you saw my brain tumor. I got that removed in December of 2024. So now I'm about 15 months out. In fact, I just had my MRI scan yesterday, and we got the report that the part that they couldn't get out hasn't grown, right, in a year. And so that's good. Thank you. These are always like big moments in our lives, because I go in and get the scan, and I'm sitting there inside this MRI machine. I'm like, I don't know what it's going to show. It could be bad. Life expectancy for a grade 2 astrocytoma, which is what I have, is 10 years, right? And yes, maybe it's going to be longer because there's new stuff available. But that new stuff that's available, I would be a bald guy up in front of you right now talking, because the traditional treatment of that is big-time radiation and chemo after they get that tumor out. I didn't have to get that because there was a new drug that just got approved by the FDA, made for exactly grade 2 astrocytoma. Not all brain tumors, but specific to exactly what I have. That was approved by the FDA in August of 2024, 4 months before I needed it based on my pathology, right? After a decade of research. And again, I don't think that's coincidence. I think somebody up there had something to do with it, right? But the reason that's important is that the cost of this pill, I don't know where my bag is, I hope I didn't lose it, because when I tell you this, you're going to know why I didn't want to lose it. $260,000 per year. My bag somewhere, I don't want to say this too loud, and see somebody else needs this pill. If you need it, take it, I'll give it to you. But I have 7 days worth, 1 week's worth, $900 a day, right? $6,000 worth of pills. I don't care if somebody steals my iPad, but I care a lot if they steal my pills, right? Seems goofy to say, but that's the reality. And this is because of NIH-funded research that a pathologist at Duke University was able to use to discover this medicine. Now that's December of 2024. January of 2025, new administration, looking at the finances of what we spend on our country, say, you know what, we're subsidizing NIH research too much, right? Private people only give about 15%. We're giving up to 60%. Therefore, we're going to cut that down. We're going to give no more than what private industry gives. If that was the case, there is no way that I would have that medicine available. I reached out to the pathologist at Duke University that discovered this, and I was like, Thank you so much. And he was like, no problem, glad to help. You're AMA president. Don't let them cut NIH funding, right? Like that was another sign. So these are the systems that I'm navigating and honored to do it, not just as a physician, right, that helps patients with all this stuff, but as a patient that benefits from all this stuff. And so these are the kind of things that we deal with as physicians that make it difficult to do what we know is best for our patients, not the stuff we learn to deal with in medical school. When I started to go through all these things as a medical student, I had this genius idea. Nita and I had just moved here. Our kids were 1 month old, and we started our practice. And all of the stuff that we were doing to take care of our patients and getting denied payment from insurance companies, I was like, I got a solution. This is when we used to have, before Judge Judy, Judge Wapner. Some of the people in this room know who that is, right? So it was like one of these judges, they had a TV show on. I'm like, I'm going to sue insurance companies, and I'm going to go to somebody like Judge Wapner in small claims court on every single one of my patients, and I'm going to sue so that they will get the care they paid for with their insurance, and I get paid for doing it. That was my brilliant, not-so-genius idea. So I drive down to Michigan State University, right? They had a night school. And it was one of these things where every night you would go and you'd spend time in the library, you would get your law degree. And I get down there, and pretty soon, I see somebody from the Michigan State Medical Society that basically says, hey, you know what? Just stick to what you love, take care of patients, join the Michigan State Medical Society, and we'll help you navigate it. And so I was like, sounds good to me. Nita was so happy that I was actually spending evenings at home with our newborn twin boys. And so that's when I joined Organized Medicine. But the purpose of that was to deal with all of these issues, right? So the bureaucracy, the paperwork that we have to deal with, knowing the right thing to do when we leave the exam room, but then having to start that process of navigating a complex insurance company to get permission to do what we know we need to do. The paperwork that we have to deal with, as opposed to actually the patient care that we would love to deal with. The other thing is this misinformation and hostility that exists. Right? So when we, getting death threats for trying to help my community learn about vaccinations and then give vaccinations for those that wanted it was something we got death threats about. Right? And not just that, but the misinformation about what's out there. When I talk about vaccinations, because we spent so many hours of school and all that learning about it, but if I didn't have charisma, right, if I was a genius Nobel Prize winning microbiologist, and I talk about why this is important, but I'm kind of boring, goofy looking, giving a speech just looking at my notes like this, I get 2,000 people, right, on my Facebook post or whatever, social media, or reading my white paper that I got a Nobel Prize for. If I'm a super charismatic guy, like an actor, with amazing Facebook videos and Instagram posts about why it is that vaccines kill people. They kill more people than COVID. Do not get it. I've seen it happen before. And I have charisma when I say that. I get 1 million hits on my social media post, right? Nobel Prize winning scientist that saves millions of lives but is goofy looking gets 2,000 hits. And on social media, somebody charismatic saying the wrong thing gets 1,000 times more. That's a problem, right? And this is how misinformation gets out there. The insurance barriers to care, knowing the right thing to do, but having to go through prior authorization. When I first got my pills, those $900 a day pills, I can understand why they need to be very cautious about how many they give me in case they don't work or I have side effects and they're like, you know what, you shouldn't take any more. If they gave me 60 days worth and I can only use 10 before I have a side effect, the rest of it goes to waste, I can kind of understand why they want prior authorization for that, right? Double checking, does this guy really need it? We need to check before we authorize it again. But that itself was a problem. As president of the American Medical Association, I traveled the world. We had a trip to South America. It was going to be about a 12-day trip. I had about 7 days of pills left. And I couldn't get approved to get an extra few days to be able to take this trip and not skip my medicine. We didn't get enough. Right? And so I have the luxury of traveling and doing all these things while my wife, who's a physician, ends up being Florence Nightingale. Right? Literally staying on the phone for 14 hours this last time, trying to get authorization for me to get a refill on my medicine. Right? This is the system that we have to navigate. That's a problem. And then we have a physician shortage in this country. Right? When we had that shortage before in the 70s, my parents were welcomed from India. My dad got out of the taxi, didn't have enough money to pay the taxi. Somebody in the hospital walks out and then pays for the taxi and rolls out the red carpet for my dad to come in because they needed him. Now when that happens, if somebody comes in as an H-1B visa holder to be in this country with an H-1B visa and starts their residency at Hurley as an IMG, which almost all of them do because it's not exactly at the top of the list where US graduates want to come for residency, that bill, $100,000 per person. There's no way Hurley can afford that. And yet this is the system we're navigating. And so we have this workforce shortage, and then we have these headwinds. And then one of the theoretical solutions is, you know what, other people can do that, right? You don't need an MD or a DO. If you're a nurse or a nurse practitioner, you can replace doctors. Absolutely, we need many people on our team. But there isn't a replacement for 10,000 hours of training with less than 1,000 hours of training, right? That's not the direction we should go in. And so this is something that the AMA is working on. And then all of these things cause physician burnout. So burnout is the number of physicians that have some symptoms of, you know what, I can't do this anymore. Not that they're going to quit, but they're starting to think about quitting. That number peaked at about 60% during COVID. And now we're finally below 50%. 49% of physicians are feeling some symptoms of burnout. What does that mean? It means they're going to retire at age 60 instead of going to 70, 75. That's going to leave us short. So these are the things that we navigate. So this is, again, the workforce shortage that I was talking about. So 86,000 physicians short within the next decade, right? 83 million without access to a primary care physician. That I understand, right? Not that it's justifiable, but why are we short that many primary care physicians? The average medical student debt, $350,000, right? And that's at a public school. That's like going to MSU, University of Michigan, Wayne State, any of our schools here. Private school, another $100,000 on top of that. Almost $500,000 in debt. So when somebody graduates and they're thinking about what am I going to go into, they know what kind of debt they have. Call it $400,000. And they really love kids. They want to be a pediatrician. But they look at how many decades it's going to take them to pay off a $400,000 loan when they make what a pediatrician makes. And they change their mind, and they're like, you know what, I'm going to be a pediatric neurosurgeon. I can pay it off in a quarter of the time. What does that do? It affects the number of people we have to take care of our kids. It affects the number of primary care physicians we have. So we're going to be 83 million people without sufficient access to primary care physicians. 80 to 90% of the counties in our country that don't have enough specialists. We see that in Flint, in the community here, all the time. Right? Having trouble finding specialists to be able to take care of us. When I started my practice, I used to see maybe 1 or 2 patients in the whole month that were coming to see me from an urgent care because they all had a primary care home. They had a primary care physician. Now I see 5 a day because they don't have a doctor or it's take too long to see their doctor. That's the consequence of physician shortages. And so these are our strategic sort of priorities. The AMA, if you look at our policy manual, if you printed it, we don't print it anymore, but it'd be like this thick. That's how many policies we have on all sorts of things, from global warming to access to health care to viruses, medical student debt, all these things. But these are our kind of, our strategies for the better healthcare system to ensure that patients have access to the care that they need, to removing these administrative burdens, knowing the right thing to do, but not being able to do them because the system is so unnecessarily complicated. The compensation, right, to support the independent practice. When people start to see the financial headwinds of being hundreds of $1,000s in debt and having a practice that's so affected by insurance companies not compensating, led by Medicare, just to be able to stay in practice, what do? We all seek shelter in those situations. You know what that shelter is? Becoming employed. My parents were both private practice physicians. They loved it. They managed it. They loved it. They worked hard, but they loved it because they were in control. They didn't have anything to fear. Now, because of the system being so unnecessarily complicated, what do we have to fear? I don't know if we can do this on our own anymore, right? 70% of doctors in my parents' generation were like them. They managed their own practice. Their patients loved them. Everyone knew exactly who their doctor was. That's who they saw for generations. Just today, I saw a patient who used to be my mom's patient, right? Because that's the system in our community of private practice. But when you're seeking shelter and you become employed, You're just a name on a wall, right? And you don't control that system anymore, right? You're seeking shelter of an employment so you can get a paycheck. But what does that do for that patient-physician relationship? Not much. And so these are the kind of things that we work on as the American Medical Association. And so you all heard about the One Big Beautiful Bill Act. And so this is something that I'm asked about a lot when I travel, about the consequences of this. And so the Congressional Budget Office, based on the Medicaid cuts, they weren't called cuts, but there were things that you needed to do to stay in Medicaid. They came with this act. And so the Congressional Budget Office, the people that look at all the numbers about every single one of these bills, predicted that 10 million people in the United States are going to lose their health care coverage because of the new things that you need to do to stay on Medicaid. And so others reported up to 15 million people potentially losing that insurance. And so right here in the city of Flint, more than 50% of people in the city are covered by Medicaid. And now if every 6 months you have to prove why you're still qualified for Medicaid, in a potentially really complicated system where you got to get on the computer, you got to prove, this, that, and the other to stay enrolled, we're going to lose some coverage. And that adds up. So 10 million to 15 million people in this country could lose their basic health insurance coverage. And so this is not a step forward, right? You can look at the time, like when we started our practice, Nita and I, back in the year 2000, we had a lot of uninsured, 40 million people uninsured in this country. Then the Affordable Care Act, a lot of people call it Obamacare, cut that number in half. Right? It didn't solve the problem. There's a lot of things it didn't solve, like it didn't decrease the cost of care at all, but at least half of those uninsured had insurance. Now it's going to be going in the other direction. And it was, when I started my practice, I had a name on my building. I was trying to, get people to know about me. I would take call at Hurley. I would come in every hour of the night to fix people's facial fractures and to fix people's lacerations and all that kind of thing. And that was when they didn't have insurance, right? So I didn't make anything doing it, but I was proving that, you know what, this guy's a good ENT, we'll send him some patients. Then that number started to get better because more people had coverage. And now it's going backwards. So these are the kind of things that the AMA is very much working on. Philosophically, I'll just tell you something that isn't in the AMA script, but it's something that's on my mind a lot about the justification to have 10 million people losing their health insurance. The people that are doing that look at the $4.5 trillion that we spend on healthcare and think this is just too much, which it is, relative, especially what we get. But the solution for that, I don't think, should be spending less on healthcare by covering fewer people. There is so much waste in healthcare. The fact that Nita and I in our office, we have a dozen insurance companies that make up 90% of what our patients are covered by. Each one of them will have its own icon on our staff's computer to navigate the prior authorization system for HAP, the prior authorization system for Blue Cross Blue Shield, the prior authorization system for this. That complexity adds to cost. Each physician in this country has 1.4 full-time employees just working on prior authorization. That's the waste of money. So if we're going to cut to save money, it should be that sort of foolishness as opposed to making people lose their health care coverage. Right? So these are the kind of things that we're talking about. So I'm at my 45-minute mark, but I'm just going to jump through these. So this is a slide that you guys will appreciate because you live this just like I do. This is everywhere I go in this country, talking about the health needs of Flint, Michigan. Again, as an example of the health needs of our country. And so the job, and it's not just the health issues that we talk about when they come to my office for that 15-minute appointment, right? That's this part of their life. What about everything leading up to that appointment and what they experience afterwards that affects their health? It's not just what we interact with for 15 minutes that's going to improve their health. It's simple stuff. Well, I shouldn't say simple. I would say easily understandable stuff. If it was simple to fix, we'd have fixed it by now. But job and housing insecurity, the consequence of stress on people's health, right? Anyone that's been pregnant knows what the consequences of high stress are during pregnancy. And it's the same way for everything else, right? The environmental contamination, whether that's the environment in general, whether that's the lead in our water, the highest poverty rate around, right? With 40%, 50% of people covered by Medicaid. And so these are the challenges that we face. One of the things I did, I thought we spend $4.5 trillion. We are great at taking care of things when the blank hits the fan, right? When you drive down I-75, we've all seen this. It's in every city. It's not just ours. Billboards. Do you have a knee problem? Call us. We got a gold star rating to fix your knee problem with the transplant. Right? Do you have a hernia? Call us. We're the best place around to get your hernia fixed. I have never seen a billboard that says, do you have pre-diabetes? Call us. We will help you prevent it turning into diabetes. Right? Do you have stage 1 hypertension? Call us. We will help you. Never saw that billboard. There's no investment in prevention of disease. So I got my lifestyle medicine board certification. The funny thing about this is that they only offer this exam in November and December, and I signed up in the spring of 2024 to take it. And just like I told you, I'm a lazy guy. I didn't study. Finally, September comes around. Everyone else is starting school. I'm like, you know what, I'm going to start studying. Didn't study. October, bought the books. They sat there on the shelf for a while, didn't study. November 1st, boom, test is coming up in 3 weeks. I'm going to start studying. So I started to flip through it. 10 days later, diagnosed with a brain tumor. And so at that moment, all my friends were like, dude, why do you want to take this exam? Just stay at home. There's no urgency to do it. You got this as a priority. And in my mind, I was like, you know, it was the Saturday after Thanksgiving. We had a lot of friends visiting because of my brain tumor, many of whom are in this room. They're all totally intoxicated, partying, drowning their sympathy in alcohol. I don't drink. So I wake up Saturday morning, the day that I'm supposed to take this exam. They're all totally hungover. Nobody's awake anyway. So I drive down to across from Somerset. There's one of these testing centers. First exam I ever took on a computer. Before it was all number 2 pencils. So I took my lifestyle medicine board certification and I passed. Right? At the moment I thought, if I fail, I got the best excuse ever. If I pass, it looks like a miracle. So I got board certified in lifestyle medicine. The reason thanks. The reason that's important is that this is something that Secretary Kennedy is very interested in. Right? And this is a interesting part of my talk. This is something that there's a lot of things that we don't see eye to eye on. Right? Vaccinations. He has a different opinion about vaccinations. And I was invited to go to the White House at the press release about dietary guidelines, why we're going to start teaching people about how to eat, making sure there's not crap color in food and preservatives and all these chemicals that just don't add anything to our health, in fact, subtract from our health, addict us to the food. And this is something that Kennedy and I agreed with. And so the new dietary guidelines came out. And so he asked me to come and be there because the AMA supported this. This was a passion of mine. The AMA wants to prevent disease. And we're going to do our part by educating so people get more than 1 hour of nutrition education during medical school, which is all I got. Even now, a friend of mine's kid is at Harvard right now, M2, he got 2 hours. That is not enough to prevent disease. We are great at taking care of the consequences of bad nutrition. We are terrible at getting good nutrition. And so Kennedy and I had, and you guys know this food pyramid. It's kind of goofy. It's got a big red steak in there. I laughed because I'm a pescatarian/vegetarian, but I was like, you know, we'll talk. So this was Kennedy and I after that press conference. And what I told him was that I know that we disagree about something like vaccination. I'm totally fine to keep that on the shelf. We totally agree on the importance of prevention of disease by eating right, by good nutrition. We'll just talk about that. And if we're getting along well and we've had 2 or 3 meetings and we're having dinner and you're in a good mood and I'm in a good mood and you want to talk about vaccinations, we'll do it then. He chuckled and he was like, sounds good to me. Next day, he puts this quote in the Wall Street Journal. And at the bottom, it basically, and at the top it says, we disagree on this, but you know, Bobby McConnell attended the White House. Kennedy said that he received a letter from the doctor meaning me, and he's got a good relationship with me. This was after basically a 120-second conversation. But he leaves there liking me. Right? We had a good conversation. We've since met 3 more times. I'll read you the text. I can't right now. My phone's on something else. But we text each other now. And the last message that I got from him, because my partner at Tenacity Brewing Company, Rob Claddy and his wife, they are very passionate about Kennedy. They loved him even before he was a presidential candidate. So I sent him a video, and Rob and Tamara were saying hi to Secretary Kennedy. And I sent it to him, and he said, you know what, I'll come to visit you in Flint. So he's going to come to visit us. He hasn't said when yet. But the point is, this is somebody that I disagree with fundamentally on something very important. But it doesn't mean we can't work together, right? We're texting each other. With theoretically, if you watch the news, we'd be enemies. But we're not, right? That's why we shouldn't just rely on social media for that. And again, there's a lot of ways to improve health outcome by making an investment in prevention, blood pressure monitoring. Simple thing to do. Tell people with stage 1 hypertension where they are and what they need to do to improve on that. And so this is something that the AMA has been very, very passionate about, was just teaching people how to screen for their own blood pressure issues. So this is us at the farmers market, right? So you guys have heard of HOSA, right? These are high school students that are interested in healthcare. This was my alma mater, Powers Catholic. And so I went with HOSA folks, and we sat outside the farmers market just measuring people for blood pressure the way it should be done. There's a right way to do it. And so we're screening everybody that comes in the farmers market that wanted themselves screened. There was a lot of them. 25% of those people had no idea that they had stage 1 hypertension until high school students told them as they're walking into the farmers market. And it wasn't the inaccuracy of the test, right? Everyone thought you need to be 130/90 to have stage 1 hypertension. No, not anymore, right? Those numbers have changed because we know the risk of even lower high blood pressure. And so this is us trying to help our community this way. The health system shouldn't suck so bad that HOSA students doing something that they love, but it's a hobby, are the way that you find out that you've got stage 1 hypertension. But if you got a hernia, you got a perfect place to fix it, that's jacked up, right? It shouldn't be that way. And so, you know, we're working with Congress to do lots of things, improving Medicare to cover things like this, the Lifestyle Medicine Board certification. You know, you see all these things that I've talked about already about ways to basically solve these healthcare issues that America has. So I'll close with this. This was my inauguration. So I was the first Indian president of the American Medical Association, despite 8% of all the physicians in this country are like my parents, immigrant physicians, not even including people like me that were born here but of Indian descent. And yet there's never been an Indian president of the American Medical Association. So it was great to sort of be on that ladder, building step number 15 after my parents' generation built the first 14 steps. That was something that we celebrated. So I wore not a tuxedo, but what's called a Nehru suit. That was a big debate, like, do I wear a tuxedo, do I wear a Nehru suit? But I knew my parents were gonna keep me in the will if I put on a Nehru suit, so I wore a Nehru suit. But these are just some of the closing remarks I gave in my speech, was that yes, we're healers, but we need to be warriors to navigate the system to fight for our patients, for our colleagues, and for the future of medicine. And so it's an honor to be the first Indian president. It's just as big an honor to be the first one from Flint. There have been 6 in the past 880 years from Michigan. So I'm glad to represent you. Thank you for everything. Thank you.
Seat. I promise this is not a hot seat. There you go.
Thanks.
Test that. It should be okay.
Got it.
Got it? Okay. What do you think? This guy's a rock star, isn't he? Okay, I'm a news guy. Where do I begin?
Well, if you're anything like Peter Jennings, you can begin wherever you want because you got me at hello.
Okay, well, let me first say this is St. Patty's Day. Everybody's Irish. I checked with Bill this morning. You're part Irish? 100% Irish? Not quite. So we owe you and your family a drink. You said they were intoxicated on Thanksgiving, so
Yeah, all right.
we owe you some drinks.
Sounds good.
How hungry is everybody in the audience for more information? You want to ask some questions? You want to engage the doctor? Let me see your hands if you do. Only one? Couple?
There's a couple.
Raise them up. Okay, I'm going to come out to you in a minute, okay? I'm going to come out to you with the mic. If you're old enough, I like to play Phil Donahue. So I'm going to come out there and work the audience. But let me start off with a couple of my questions. Are your views the views of the AMA? How much do they line up and how much are they different?
Yeah, it's a good question. So the views are inside my head. What I say at the microphone is 100% consistent with AMA policy, right? Because the president speaks on behalf of the American Medical Association, not on behalf of themselves.
And
That's kind of the rule,
Is that the case tonight too then?
100%.
Okay.
Right, but what I will say is that you will find that probably 95% of the things that I would want done is the policy of the American Medical Association. So there is, you know, it's like, you know, you can have best friends that disagree on 5% of stuff. They're best friends, right? And so, yes, it's something that I agree with almost everything. My ideas on how to do something here and there might be a little different, but probably 95% agreement.
You, your term as AMA president expires this summer, correct?
83 days.
Wow.
But who's counting?
But yeah, you're not counting.
But the example I give of why I say that is like, you know, if you run the Crim and you turn out onto Saginaw and you see the finish line there, that's the feeling I get. Like, I'm almost at that finish line. It's not that, oh my God, I can't wait to be done with this, but when you see that, you run harder. So I look at it every day to see, okay, I got 83 days. I can run hard.
So what's your balancing act? How do you find time to do both, seeing your patients here, living the life in Flint, being the AMA president? I think you said you're on the road 200 days a year?
Yep, the 200 days.
So
it's a
is
little
it-
bit nicer being in Detroit where it's the Delta hub, because if I was in the middle of Kansas, it takes 3 days to do each of these trips that I can do. Like, I fly to DC in the morning and fly back in the evening. That's a luxury.
All right. Speaking out on controversial topics can carry a big risk, especially in this current environment. Have you been criticized for doing so? And I could see some framing you in the position of, well, you're taking this position because you're protecting your cushy life as a physician. What sort of headwinds have you run into with that?
Yeah, I mean, I guess the example that I would give to that person that thinks I'm into it for my own best interest is the Medicaid thing, right? I'm not looking to make sure that everybody has coverage from Medicaid so I can go out and buy a sports car. That's not what Medicaid even keeps up with, right? The purpose of Medicaid, my policies on that, my goals in that is to get people coverage so they don't let stage 1 cancer turn into stage 4 cancer because they know they can go to the emergency room if it starts bleeding, but they don't have coverage to get it biopsied when it's not an emergency. That's why we talk about things like this. So it has nothing to do with an interest in trying to deposit more in my bank. It has to do with improving the health of our country because of the graphs that I showed you. And I think that spending that on the administrative stuff as opposed to the patient care stuff is a waste of money.
We had some big breaking news late yesterday when a federal judge in Boston ruled that the HHS policy change on vaccines was done illegally. Bobby Kennedy Jr. replaced the panel of experts, and the judge ruled that vote was now invalid. A lot of layers to this, and when that happened, Michigan had moved away from this new federal guidance.
Yep.
Your thoughts on all of that, including this new court ruling?
Yeah, I think vaccinations are important because I don't want to see measles be the highest number it's been in 20-some years. I don't want to see things that we can prevent with vaccinations come back. I think they've been enormously helpful, not having to deal with things like smallpox, like polio. The solution for that, ideally, would be good information getting to people so they can help make that decision themselves with their doctors. The fact that this is a decision in a court, the end result is good because there won't be misinformation out there about vaccinations when people that aren't necessarily good, neutral evaluators of it, but kind of go to the discussion room with the predisposition to be against it, as opposed to just look at the data and what does it support. This gets us there, but I would say it's less than ideal because you know what it's like when people go to court for, it's a fight. I don't know what Secretary Kennedy's gonna do or what our president's gonna do to fight back, but I would predict that it's just gonna be a battle and who knows how it'll go, but that's not the ideal.
Oh, they've already said publicly they
Yeah.
will appeal this, and they look forward to it being overturned on appeal.
Yeah. So that's, in the meantime, physicians and other healthcare workers are going to continue to have conversations to teach people about what the difference between mRNA and DNA is and what it does and help them improve their health while the courts decide, what the government's influence on it's going to be.
You talked about attacks on science, misinformation. Some would say our new leaders in office a little more than a year have become much of that. Do you agree?
Yeah, I would say that, yes. But how do we deal with that? I think that, for example, the CDC, where everybody would sort of say, we trust you guys, you tell us which vaccines we should get at what age and based on what data, we trusted them, right, around COVID. Now, our country's trust in the American Medical Association is higher for this information than the CDC, the Center for Disease Control. People trust me more than they trust the CDC. So this is a consequence of exactly what you referenced. And so yes, this is a problem. I don't want it to be that way. I would love to give this ball back to something as important as the Center for Disease Control, but that trust needs to be regenerated. Confusion doesn't lead to that, and that's what's happening.
You talked about RFK Jr., and I asked you this question upstairs, but I'd like this audience to hear it as well. When you talk with him and you know his position on vaccines, how much credibility do you give him, medically speaking?
About vaccines or about healthcare in general? Because that's his.
Overall.
Yeah, I don't judge people as a whole based on their opinion on one issue, right? I've got this guy up here in the front right here that I've grown up with since I was 5 years old, right? I think he's a fool about 5% of things. But we agree on 95% of things. So in the same way, if I can tolerate my friend, I can tolerate talking to RFK Jr., not because I judge him on the 5% that we may disagree with, but we are both passionate about not wasting money on healthcare when we can prevent disease, right? Now, I think it's funny that he does videos on social media with Kid Rock about lifting weights and sitting in a jacuzzi and all this stuff. Not my style, but that's okay. He can do it. I'm not going to pose like that with him because I don't look as good with my shirt off as he does. But I'm happy to work with them on what we agree on and just understandably disagree on the stuff we don't. And that's where friendship goes, right? If he's tolerating me since we were 5 years old, 50 years ago, then RFK Jr. will tolerate me just fine when we get along and then start discussing things we disagree on.
I was actually going to ask you about that workout video, but I thought, no,
TMI.
too
Definitely don't wanna-
lowbrow for this crowd. All right, I'm going to come out to the audience. Stand by.
All right.
This old body got too comfortable. I'm going to start with a couple of people in the front row here because I want to introduce them. Perhaps dignitaries. Step up. Stand up,
right.
Michael. This is Michael Danek, who is the president of the Genesee County Medical Society. Thanks for coming tonight.
Oh, thanks for having me. It's great to be here.
Yeah, give him a round of applause. David Hoff, the executive director. David, step up. How are you?
Good. Thank you for having me this evening. I appreciate the invite.
Great to have you guys. Do you have anything to say to Dr. Bobby?
Yes, Dr. Bobby. Can I talk to the crowd instead?
Please.
It's just easier. So, I'm actually one of the people that was mentored by Bobby starting 25 years ago when I was a medical student. So I grew up in Redford. Then because of him, I moved to Flint. I don't know if the next place is Saginaw or not,
Nope.
but just moving up in the world. I love Flint. Why? Because it's so sincere. So I'm actually a cardiac anesthesiologist. No one feels bad for me. Oh, that poor guy, how is he gonna make it? But I had $350,000 in debt. It's there. My son's going to medical school. How is he going to afford it? We don't know, but he'll find a way of some sort. And then everyone's complaining about money loss. The nurses aren't making enough money. I have not had a raise in 18 years. No lie. 33% of what we get is nothing. 9% for anesthesia for Medicaid. And it's the same care for every person. Most people don't understand that there's no money coming in. And then we have our community like this. Physicians. No one wants to come to Flint. Why? Because it has that reputation, but we're trying to build that. The hospitals, every hospital is complaining. We don't have any money. We're $1 million short. Now the insurance companies, we're all losing money. We don't have any money. The schools, we don't have any money. So when you talk about waste management, shall we say, how do you think the best way to do that? Because when politics gets involved, when we had Doge, everyone's like, well, this is a terrible way to do it. But how can we get some bipartisan group to say, let's really cut the waste?
Yeah, so it's an interesting question. I'll just tell you a quick story with the answer. So there's a guy named Bill Cassidy, the senator from Louisiana. And so I was at a restaurant in Washington, D.C. with him and about 20 other people just about 10 days ago. Everybody around that table was the CEO or leadership in one of these things that talk about struggle. And I don't tend to mince words, right? I love being from Flint, right? We have tenacity. And I don't owe anybody anything. I don't have a boss. Well, my boss is in the front row here, and she yells at me all day anyway, and so this is not anything new. But what I said is that, look, I take this pill that costs $900 a day in the United States. If I went to Canada, if my parents got it from India, same thing, not a generic form, exact same pill, it costs $60 per day. 960. And I've got the heads of pharmaceutical companies at that same table talking about how they need it for research. Come on, right? And so I think there's sort of people with their sales pitches for why they need more, but we give our sales pitch. And what ours has to do with is just having patients have access to care to prevent them from needing a pill in the first place, right? If we could stop prediabetes from turning into diabetes, they're gonna need less insulin. Go figure. And that's an investment. And so of all the things that we're giving lawmakers the ability to decide, okay, this deserves it, this doesn't, I think ours is the easiest argument to make.
On that note, Mark Cuban, cost plus drugs, generics for conditions like cancer, diabetes, cardiovascular diseases, a flat 15% markup, cutting out the middleman to save money for consumers. Is this the direction we're headed? Is this a good idea?
Yeah, I think it just, I mean, he would never have access to the pill that I need, right? That's how novel it is.
Yeah, this is generics, right?
Yep.
Right.
But for insulin was something that was discovered and given away by the people that discovered it for free. Now, you need prior authorization every 90 days to get your insulin from an insurance company. So this is where Mark Cuban stuff comes in handy, right? And so he was just at the AMA a few weeks ago in February. And so I was on the stage first with our classmate at Michigan, Sanjay Gupta from CNN, who's one of the medical correspondents from CNN. And then Mark Cuban was on the stage after us talking about exactly this influence on a stagnant healthcare system that just is the way that it is. This is a very novel idea to say, hey, look, I'm not a scientist, I'm not a doctor, but I know financing, right? He's on that Shark Tank show. He knows all about that stuff. And so this is his Shark Tank approach to saying, this is so screwed up, I'm gonna do this. I think it's a wonderful way to prove that the system lacks function, and this is something that brings us to the attention of what can improve that function.
And on that same note, somewhat related, CBS Sunday Morning recently did a story about healthcare insurance denying claims, playing a numbers game. You talk about prior authorization. Isn't this inevitable in a for-profit system with for-profit insurance companies? And full disclosure, I was a field producer for Michael Moore in his movie Sicko in 2007.
Yes, yep. You know, I think there's a balance to that answer, right? Capitalism is an investment in giving people what they want and need. And I think that there is a downside to not doing it that way. But there is a right way to do it. Because right now, if there isn't profit in doing something, it doesn't get done. We need a safety net, right? And so if I watch news every day when I come home for my lunch break. Every 15 minutes is an advertisement for some drug. And now I go to GoodRx every time I see that advertisement to see what it costs. It's never less than $1,000 a month. Sometimes it's $10,000 a month. I've never seen an advertisement for amoxicillin, right?
That's what's paying for those commercials, though.
Right, except, so what I say is that if there's no profit in making amoxicillin, and there's one lab that does it, and something malfunctions in that lab, what are we gonna do? Those of us that work in the hospital, I get weekly emails about a shortage of this, that, or the other. And it's not cutting edge stuff, it's the basics. And so we need a safety net. Yes, we should incentivize being on the cutting edge and making cool stuff. But we need a safety net when the stuff that we need just ain't so cool that you can't charge a lot for it.
So how do we get there? Do we need a healthcare crisis? I mean, we're in Flint, Michigan. We know about a healthcare crisis, a water crisis. What's it gonna take to finally move the political machine?
Right, so one, there's crises that are epidemic, right? That just boom, just blows up.
Somewhat measles right now.
Right, right. And then there's things that are pandemic, right? It's not like a 1-month disaster, it's a years-long disaster. And so I think healthcare is in disaster mode, but not in boom, but more like this sucks, this sucks, this sucks, right? That's kind of where we are with it. And so how do we do that? Unfortunately, the solution for that comes from Washington, D.C. Right? It's not going to be industry. Industry tries, right? So prior authorization, 2 times before this year, insurance companies said, you know what, you're right, we're doing this too much. 2 times, nothing changed. This time they did it in front of Kennedy and Oz, Dr. Oz. Who knows if it's going to change? But I don't have faith that they're going to do it because it's right. That's just not the nature of things. So it takes lawmakers to be able to make it do what's right. Like we revised prior authorization in Michigan. We have a Health Can't Wait Act that the lawmakers passed that says if you're going to have prior authorization, you better do it in 72 hours. If you're going to deny it, it better be the same level of education as the person that's asking for permission. If I want to do sinus surgery, it better be a sinus surgeon on the other side of the phone that says, you know what, I don't think you should do that. Not somebody that's not a physician at all or a physician of a different specialty. So there's a right sizing of all of it that the government can do. And so that's why that's who we talk to.
Stand by, I'm going to get to you in the audience. I want to introduce Brad Snyder, who is the Deputy Health Officer from the Genesee County Health Department. Thanks for coming tonight.
Thank you.
For the record, you're not related to Rick Snyder, are you?
No relation.
Do you have a question for Dr. Bobby?
Not a question, but maybe a statement, and it's just something to share with the audience. We are so, at the local health department here in Genesee County, we're so honored and privileged to have such an amazing physician advocate for public health here in our hometown, so I want to thank you for that. Just in recent memory, some of the things you've done for the local health department here in Genesee County during COVID, you helped volunteer to vaccinate thousands of Genesee County residents during our massive COVID vaccination clinics. It's actually where I met Dr. McCumlough for the first time. And also recently helping us to promote HPV vaccine awareness and educate on that and be a champion for that to help reduce and eliminate HPV-related cancers here in Genesee County. So thank you for that. And thank you for continuing to be a public health champion here in Genesee County.
Thank you very much.
Doesn't get any better than that. Okay, who has a hand up? I'm coming to you.
And just a quick note on the HPV vaccine, everyone assumes that's for some, GYN-related cancer. Head and neck cancer is more caused by HPV now than it is from smoking, right? That's what people need to know. But so thank you.
Hi, good evening. Got a question for Dr. Bobby?
I sure do. Thank you. I'm Josie Ballinger from Traverse City. I'm also the great-granddaughter of Ballinger Eminent Persons Lecture Series. So, the
Good
benefactor.
Genes. Good genes.
So, you touched briefly during your presentation on NIH funding, and I wondered if you could elaborate on that in terms of what impact the budget cuts last year with DOGE and so forth have had on our nation's research, and also the position AMA is taking, and what's your prognosis, if you will, for next year's budget and beyond?
Yeah, so the details of the NIH funding. So there's direct cost and indirect costs of doing research. Direct cost is actually doing in the lab what it takes to prove that this works or doesn't work. Indirect costs, keeping the lab clean, right? Mopping the floors, getting new instruments if the old one breaks. Just the basics of running a lab. It's not for a particular project, but it still needs to be funded. And so the indirect costs are what the government used to do more than the private industry did. If I got some new drug that I want you guys to study and see if it works, I want to pay for the study of that drug. I don't want to pay for the window that breaks when you guys have a snowstorm, right? So, but that's what the indirect cost is. So that's the nature of what the government used to subsidize just to keep the lab open. And now, a lab has to decide if we're going to lose all that and we need to change what we budget for because we have less coming in and we need to use some of this to keep the lab open as opposed to doing the research, there's going to be less creation of the stuff that saved my life, right, or is saving my life. And so this is the system. And so how do we solve that problem? That's something that was proposed last year, because of DOGE and trying to figure out what these numbers, where can we cut, right, to get the numbers looking good. But it's something that there's a lot of lawmakers that totally understand the consequence of if this happens, it's going to take us backwards as it relates to the science of healthcare. So there's a lot of lawmakers that when you see them as individuals, they understand, right? Like the H-1B visa waiver that I talked about, the $100,000. There's lawmakers now on both sides of the aisle, bipartisan, that are looking to make an exception for doctors so we don't have to pay $100,000 each to have people take care of our community. So that's the conversation we're having at that level, because that works its way up, and then they decide, you know what, we're just not going to do it. There's not going to be a headline, hey, we decided not to do it. It's just going to disappear, and I'm totally cool with that. So I'm optimistic.
Question. Go ahead.
Hi, I had a question actually about the H-1B visas. Right now is match week, and so a lot of the people that I'm working with are going through match week, and they've heard that there's an increased number of open spots because hospitals are not taking as many international graduates. My question is, do you think it's more important to prioritize getting like the brightest people around the world to come to our residency programs, or prioritize American medical students in our residency programs?
Yep. So I think both have the advantage, right? One knows, let's say their test score coming from a different country are higher. Their knowledge of our culture is less. Both are of value, right? And we interview all these people. But the other thing I would say to the first part of your question, as far as when we don't have them coming in, there's more spots for US graduates. If we didn't have any H-1B visa holders coming in, because all the hospitals said, you know what, we can't afford an IMG anymore, that hospital is not going to fill up with US graduates. They don't come to Flint. And so we're going to have 30 less residents if we leave it to US graduates to come to Flint. What does a hospital like Hurley do when they have 30 fewer residents in a year because H-1B visas or J-1B visas now, which are now kind of on hold, are going to leave them short? It's going to be a disaster. So it's not like it's taking from one group that would otherwise come. We're filling in a void by having people like that come.
Step up. Stand up. Over here, doctor.
All right, so as a social worker in a qualified mental health profession, I heard you speak on systems a lot, and I work against the systems every day. Mm-hmm. So I'm wondering, with you having 83 days left, what is the next steps with you helping to dismantle those systems starting here in Flint?
Yeah, so I would say it's a totally legitimate question. But when I talk to people about the system failing, what is the solution for a failing system? It's not a one hit that solves that system. There are multiple aspects of what leads to the failure of the system as a whole, right? One of them is finding somebody to take care of your health. One of them is affording the health that they're prescribing or asking you to do. One of it is an investment in prevention of disease, right? These are all parts of the failure. But if we look to, what's that story about the guy that tries to hit a grand slam and ends up striking out? What's that dude's name? What's his name? Casey, yeah. What's his name? Casey in the bat. Yeah. So Casey's swinging for a grand slam, right? Totally struck out. I blame that forgetfulness on my tumor, by the way. It's like a get out of jail free card.
We'll give you that slack. Go ahead.
Yeah, but if we just go for a series of base hits, we will solve one of these problems at a time. Just like we're dealing with prior authorization, just like we're dealing with Medicaid cuts. Totally different problems, but all of which, when you summarize it, affects the healthcare of our country, right? Flint has a wonderful example that I use in my speeches. Remember Auto World? We were trying to hit a grand slam with the shrinking of our city by putting in a Six Flags amusement park called Auto World. Where is it now? Gone.
I was there for the implosion. I covered the implosion.
Yep. So instead of going for a grand slam, we are now going for base hits. And I'm totally cool with that.
Sorry, he's got somebody. Question? Go ahead.
Yeah, I'm Larry Anderson. I'm a retired physician assistant after 40 years in primary care, where I found most of my time, well, a lot of my time, helping people find access to care, dealing with things like prior authorizations, besides providing their medical care. my question is, does the American Medical Association have a policy on universal health care? And if not, why not? And if they do, who are the biggest barriers to us getting there?
Great question. Single payer. Great question.
Not quite. That's not what he asked.
Well,
He asked
all
for
right.
universal health care. Right. Universal health care is making sure that everybody has access to health care.
Okay.
Not necessarily that the bill is paid by one group, right? So yes, we have very big policy on universal health care. Everybody should have access to health care. It's a human right. Those are my comments about if you don't work, you don't have access to health care. That's not universal health care, right? That's universal health care for people that are either volunteering or work. So we want universal health care. This is why we speak out about that. And then how do we make that happen? That's something that only lawmakers can make happen, right? That was one step in the right direction with the Affordable Care Act for part of it, getting coverage. Didn't decrease expenses, but at least we're moving from 40 million that didn't have it to 20 million that didn't have it. That's our goal. That's why we endorsed it, even though there was a lot we didn't like. When President Obama came to the AMA before that vote to try to tell us why he thought that was a good idea, the majority of us agreed. So yes, we want universal health care. How does that happen? Through lawmakers. We have to convince them. And so that's why we're hoping, because that whole Medicaid cut stuff doesn't really take effect until after the midterm election. I don't think that's a coincidence.
How active is the AMA in that lobbying process?
Every day, 365 days a year. We have an office in Washington, D.C. Our chair of our board is giving testimony tomorrow. I think he flew in from California today on this kind of issue. So we're there every day. Thank you.
Hi. Yes, I worked with low-income families for most of my life, and I agree totally that good food, natural food helps. However, good food costs.
Mm-hmm.
It really does. Processed food is cheap.
Yep.
You have a food deserts in Flint. I mean, I live where I can get food and I can go to farmers markets and everything and come home with fresh food. And I have the resources to do that. And this is not just for children, it's for the elderly, it's for everybody. How do you make it so that all of us can afford the foods that Bobby Kennedy and you and I want people to be able to eat?
Yep. So I mean, that is the heart of the matter. Right? What I say a lot in my speeches, my parents came from India. Poor people in India, so skinny you can see every bone in their body. Poor people in our country suffer from obesity. Why? Cheap food is the unhealthy food, right? If we have a easier time getting Popeye's chicken than getting fresh groceries to have a meal at home, that is exactly the outcome. So how do we solve that problem? Not all of it is access to food, although that's a huge part of it. But one thing I don't want to forget is that when you are a single parent in a family with kids and you've got a job, if not two jobs, and you have to go grocery shopping and make the stuff that's a whole lot longer to do than microwaving something that's crap, that's part of the problem. The other thing I mentioned is that, you know, I give a lot of speeches to medical doctors groups all over the country. When I go to University of California, San Diego, and I tell them that we've got to drive half an hour to get to the closest Whole Foods, which all those people get all their groceries from Whole Foods, like amazing stuff, expensive stuff, but in fancy suburbs, and we don't have that luxury, let alone it be cheap luxury, that's a problem. Right? And so that's why I'm honored to be on the board of the Mott Foundation, which really tries to get healthy food access for Flint in the grocery stores and stuff that it's trying to invest in to make happen. It is not an easy thing. This is where we need somebody like Kennedy to add the financial benefit to doing this. Right? It's a government investment in doing it, because you got to have that too, fortunately or unfortunately, depending how you look at it. And so this is the reason that I would love to bring him to our farmers market, right? Why he said yes, he would come, to show him what we're trying to do. But don't just ask us to be healthy again, but don't do anything to help us get there. And I think he'd be honored to be here for that, because I think that from, again, the little that I know him from a few meetings and some text messages, he likes that idea. It's not just a speech and a scene with Kid Rock.
I was curious about your thoughts with the rise of chronic illness in the younger generation, especially after the COVID-19 pandemic, and how it seems like a lot of healthcare providers don't seem to believe young adults trying to advocate for themselves.
Oh, I don't know about that last statement, because absolutely, I do totally understand and think that young people should. Colon cancer, for example. The average age of colon cancer diagnosis is getting younger and younger and younger, right? So absolutely, I mean, we talk about that a lot, but there's lots of reasons that happens. Part of it is detection, right? When you look harder, you're gonna find more, but that's a good thing. But it's not all that, right? The true risk of associated with something like that is likely something that has to do with our environment, our nutrition, our access to care, that sort of thing. And so absolutely the AMA is big time advocating for exactly the solutions to those problems, instead of just saying, oh, there's more cancer, we need more docs to cut it out. Sure, we do, but if that's the only investment we make and don't invest anything in preventing it, we're gonna be exactly where we are now. Great at taking care of stuff when the blank hits the fan. Anybody else? Oh, somebody here's had a question for a while, actually, sorry.
I'm sorry. Well, okay. I'm getting pulled many directions. Go ahead, stand up.
Mine's just simple. Is there anything that can be done to coordinate, like when we go to the doctor's office and we fill out all the forms,
Yep.
and then you go to another doctor and you fill out another form? Isn't there something like, go to Hurley and they have everything. You go to McLaren and they have, can't we?
Yep. So this concept is called interoperability, and it doesn't, interoperability, right? This is something that I'm passionate about. The AMA board, when I started, and all I talked about was this exact issue. The fact that NIDA does a robotic hysterectomy using a robot called the Da Vinci robot, and then comes back to the office and has to fax the operative note to the referring physician. You know, when I said this at the Consumer Electronics Show, where everybody that makes everything from, you know, amazing technology, TVs, satellites, like Samsung and Toshiba and all these companies, when I told them that we were still using a fax machine, they thought I was kidding. They literally thought, nobody uses fax machines anymore. I was like, heck, I don't. I go to Sam's Club every month to get toner for my fax machine. This is because of a lack of interoperability. This is a total failure when we trust Epic and Cerner to just, yes, we're gonna make sure our communications happen. They have zero incentive to do that, because they all want to be the one that everyone ends up using. So why make it interoperable where nobody has to change? The example I use is my Verizon phone can easily call your Sprint phone, right? That was just a rule. You couldn't do it where you can only call Verizon, you can only call Sprint. The rule was, if you're gonna make phones, they gotta be interoperable. We never had that rule and as it relates to medical records. Big mistake. And so we wanna make sure that we don't do the same thing with things like AI, right? We wanna be there when we decide what are we gonna use artificial intelligence, or what we call it augmented intelligence for. We wanna be there from step one, instead of getting some product that is good in some ways and sucks in other ways. And we're still working on interoperability. There's a whole task force. I sit on the board trying to get this done. What I see is that the companies that make the electronic health records fight back by saying we need patient privacy. We can't have it be so portable that somebody finds out that, oh my God, I got a hernia. We don't want that to be public. So it's gotta be supporting privacy. So they're saying, let's not make it so interoperable that privacy is at risk. And honestly, privacy is important, but I want every hospital that I go to know I got a freaking hernia if I have a hernia. You know what I mean? And so to use that as an excuse for not having portability is just a game, so they don't lose market share. That's a problem. They want to be the only, yes.
Hey, this is more from a medical school standpoint. I'm going to medical school in July, and you mentioned that there was a problem with choosing specialties, you know, going into surgery rather than doing like primary care, internal medicine, because they don't have as much, you know, payout. And obviously that's a huge issue, like you said, primary care not being accessible for most people. So how is that something that you had, like, any ideas for you to fix that?
Yep, so as far as the difference in compensation that makes people go towards a certain thing other than something that they love, yeah, so this is something that AMA works on constantly, right? And much of it has to do with medical student debt, first of all. The less that is, the better. The better loan it is from the government instead of Bank of America with higher rates and like more punishment if you don't pay. There's more flexibility in the loan part of it. I would 100% agree that the other side also needs to be the cost of that, right? So the cost of the education, the amount that leads to that debt. And that's something that's an interesting conversation with our universities, right? Because you hear from them how they can't cut it down because it costs more, there's more to teach, we need more classes. Now we're teaching dietary guidelines in class, that's a whole other class we gotta do, that costs money. So that's part of the conversation. And then the major part of it that the AMA works on is what is your return on investment? If your return on investment is a third in this decision of being a primary care physician as it would be with this decision, that gap needs to close. Not just for the student debt part, but I think it's an investment in prevention of disease. I take care of people's noses when they're backwards, when they're crooked, right? When they got something growing in it. But I'm that guy that does that. What I would love to see is how do you teach people how to prevent that from happening? When somebody comes in for sleep apnea, right? We all heard about CPAP. When somebody can't tolerate CPAP, I trim their tonsils and their uvula. I cut stuff out so they can breathe better. Who is it that's going to talk to them about their BMI of 40? Right? I wouldn't have to cut out their tonsils and their uvula if their BMI went down. Who's going to be able to do that? We need to prove to people that that's going to be an investment in primary care physicians being able to spend 30 minutes with the patient and give them amazing care, have enough of us to do that so people aren't waiting, but invest in disease prevention to get us healthier. That's an investment, and that's where we really need to advocate. And that's where, you know, whatever you say about the acronym Make America Healthy Again, I'll leave that to you guys. But what I would say is if you want to make America healthy again, let's help with their BMI of 40 instead of cutting on them in a hospital by having the time to be able to invest in the improvement of their health and compensate the people that make that investment of time enough that it's worth it, instead of them struggling to pay their loan because they got to see more people.
Hi, Dr. Bobby. I've been in the community for a little while as far as like chef and nutritional work. So I wanted to touch on and thank you for a lot of the work that you've done in the food community because we touched on a lot of the food deserts and stuff like that, but also going forward in the American Medical Association as far as like Eastern medicine and good quality food and herbal medicine. I just wanted to know your opinions on that because I know you grew up in an Eastern medicine type of household.
Yep.
So I was just kind of curious as to the nutritional guidelines, but also having these Eastern medicine style foods available for our community and just where Mott community and yourself stand on that going forward.
Yeah, yep. No, it's, thank you for that question. It's a great question. What I would say is that we grow up in a certain way and we have a certain preference for what our cuisine is, right? It shouldn't be that you have to change what you grew up with to something because this is healthier. We can make everything healthier, right? We can, like for example, you saw that pyramid, the upside down pyramid now, there's a big steak in the corner, right? And so instead of saying, you know what, I grew up in a family of vegetarians, I'm a vegetarian, you gotta be vegetarian, that ain't gonna fly. You know what I mean? But if we can say, if you burn your meat, it increases the risk of cancer, so this is how you should cook it instead, that's huge. It improves health by eating things the right way. So again, meet people where they are and do the things that they are willing and able to do, as opposed to telling them something to do that's going to be impossible for them to do. Right? So that's again the difference between kind of moving to an Eastern cuisine than a Western cuisine. If that's not how they grew up, it's just going to be hard to do that. Sure, I would love to tempt them with that, right? But we need to meet people where they are and teach them how to prepare what it is that they love in a way that minimizes the risk. Not just the preparation, of course, the amount that they eat of this versus that. But both are very valuable. And that's why I love having our farmers market, right? Where I see what somebody else is buying, they see what I'm buying, they're friends of mine, they're new people. I'm like, hey, what are you doing with that thing? And then they tell me their recipe. And this is a beautiful enough, small enough town where, heck, I'd say there's a 50-50 chance that they'd invite me for dinner and I just met them that day. That doesn't happen in fancy cities, but it happens in our city, right? And that's what I love about it. Sorry, I digress a little bit.
We're running a little bit over. I want to get in one or two more questions, and then that's it. Go ahead.
Hi, I'm Joanne Pratt. I work in the city of Flint. I happen to be the school nurse for Powers Catholic.
I've seen you there.
Yes, and St. John Vianney. What I see sometimes, well, I know you see it all the time. My question is, it feels like the insurance companies are practicing medicine. And I think you're right. It's not always a doctor on the other side who's denying the authorization. So are you seeing any changes in that, like a plan or a path forward with that?
Yeah, yep. So so in Michigan, we had our Health Can't Wait Act. At the national level, we're having insurance companies confess that, you know what, this is a problem, we're going to fix it. So it has to be by law. And it's the basics. One, just the transparency of it. If you're going to require prior authorization, how many of this one are you approving? If that number is 99%, why the heck are you asking for it? Right? So just transparency of the data of how many are you approving, how many are denying. If you're going to make that decision, make it in 72 hours for a normal thing, make it in 24 hours if it's an emergency. Make it be somebody who has the same knowledge and training that's going to say yes or no. Right? Health Can't Wait was probably about 6-7 years ago. Yep. And again, it rolls out. They don't do everything immediately. It improves with time. So it's getting better. But you know, the funny thing is, insurance companies fight it even after it's law. And it's a constant battle. So this is what I would encourage. If any physicians in this room aren't members of organized medicine, you need to be if we're going to win these battles.
Question. Has the AMA considered advocating that the government pay the loans for physicians who choose primary care residencies to take care of this problem?
Yep. It's a great suggestion, and I would say that those things are being done, yes, at a national level and also a state level. Right? So there are incentives to get loan forgiveness for going to rural areas, for doing primary care. And this is something that Michigan has, actually. But we're looking to grow it because it's almost experimental-ish still, as opposed to being able to handle a huge, bigger capacity. So this was a conversation I had with actually John Cherry, our state senator here, just about a year ago, about expanding what we have. The Mott Foundation was very interested in this as well. In fact, it was a group meeting. So yes, there's already proof of concept that this works to keep people in primary care when you give up $250,000 or more in loans. But growing it to make sure that our program can support the need is kind of the step that we're at. It's not big enough, but it's been proven to work.
Okay, I have some lightning round questions to wrap up the evening, and as I go through these quickly, we are going to put up on the screen for you to get your CME credits. You guys can see that when it comes up. There you go. Hit that QR code. Okay, quick questions.
All right.
Most important career advice you were given, not forced by your parents.
I would say do what you love, right? The idea of putting in 40 hours a week doing something we don't love so we can get home and do something we love is not ideal. Not everybody will find what they love, but if we can find what we love, none of this work, none of the 200 days I spend or the hours I spend taking care of patients feels like work.
Most important medical advice you were given before your cancer.
Before my cancer. At that time, honestly, I was pretty healthy and I wasn't getting much medical advice except for the screenings. But what I would say now is, again, I'm a big fan of diet and nutrition. I would say that the more we focus on diet and nutrition, the healthier we're going to be. And so that's the advice I would give somebody now, before their diagnosis, about preservation of health.
I knew I would be a physician when?
When my parents forced me. I didn't have a choice.
I should have put that proviso back in for that one.
I'm not a liar. I just tell it like it is.
All right.
But I'm proud to be a president of the AMA now. They had good advice. I didn't know it at the time.
All right. The case project I'm proudest of is, other than your own?
HPV. So when I started, we do research when we're medical students, so I did research on HPV, trying to figure out exactly the DNA of HPV and all this. And now fast forward several decades, and we found a way to prevent head and neck cancer and cervical cancer that started with research that I was doing in the 90s.
Most overrated medical procedure.
Wow, good question. So I guess I can only talk about the things that I do. I fix a lot of crooked noses, right? Deviated septum.
A lot of boxers?
No, just people that have crooked noses.
Okay.
And what I tell them, and I try to tell them, I was like, look, man, I looked in your nose, my nose is more crooked than yours. And I show them, I'm like, I can breathe through this side. When I breathe through this side, totally jacked up.
Okay.
But they still want it fixed. So I'm happy to do it, but I try to demonstrate to them, you could live with this if you wanted to.
Right. Most underrated medical procedure.
Procedure. That's a tough one. I guess what I see in my practice is that kids that don't hear, and that's due to ear infections and fluid in their ears that we can cure by just buying them 5 to 7 years of life without ear infections, by putting something like tubes in or being better at decongesting, treating their allergies. The Michigan School for the Deaf, we all know about that, right? It used to be massive. It's where Powers Catholic is now. The reason they don't need that anymore, we've gotten much better at treating infection that causes hearing loss. And that's phenomenal, right? We have that in our own hometown to demonstrate that. So yes, that's something that I would say is one that I'm very proud of as a community and a profession that has the huge impact in making it unnecessary to have a building that big because we're better at dealing with it.
Could holding this AMA leadership position become a launching pad for a career change away from seeing patients and more toward high-profile policy work?
You mean being elected?
No, but I mean, you've gotten a taste of this.
Yeah. I would say my answer to that question is very different now than it was 2 years ago. I have a brain tumor, right? My life expectancy, if you Google grade 2 astrocytoma, is 10 years. So if I have 10 years, would I want to do what you mentioned as far as go and be an administrator or elected leadership and influence on healthcare in Washington, D.C., knowing how polarized our politics is right now? It just seems very unlikely to lead to an amazing outcome. Just the odds of success in a decade. The other thing that I'm passionate about is this community. Right? When I see that our college readiness rate for kids that graduate from the one high school we have in Flint, their college readiness rate when they go to college, to start with a 101 level class, 4%. 96% are taking other classes to catch up to be able to do that. And when I think about going to DC and arguing my butt off about things that I'm not likely to be successful on versus doing ENT in the morning and teaching science in Flint Public High School, which is going to be a new one, I would see the second one as much more appealing to me. So that's the plan.
Final four, moving into the tournaments. And you've touched on this, but you might have a different answer for the short question. I knew I'd made it when?
When I look at my Delta miles and I see that I have enough that my wife gets upgrades everywhere she joins me because I've traveled so much, then I'm like, I'm getting invited to a lot of places. I've made it. I go to Louisville on Friday.
He is creative. Next one. Failure means?
Learning, and learning from that failure so we can do better the next time. I don't consider it failure at all.
Success means?
That it was worth the investment of our passion and time, and it should encourage us to reinvest it for the next thing that needs success.
And the final of the final four? Reaching the summit means?
I think the summit is like finding gold at the end of the rainbow. We think it's the summit, we go after it, but it's never the summit. There's always something more to improve. So it's never time to celebrate like everything is done. It's temporary celebration while we dress up and get ready for the next challenge.
There he is, Dr. Bobby McCullough.
Thank you.
Thank you very much.
Good to be home.
Really quickly, before we all leave, just want to give the young lady in the back, she had a question. I just wanted to let you know, ma'am, with the black shirt, if you wanted to ask Dr. McCullough personally, because I know you had a question, you had your hand up, but sorry we ran out of time. Oh, that's your neighbor? Okay. We also want to, if the team from the Ballinger Lecture Series can just raise their hand, the planning team, just so that people can kind of see who you are. Thank you so very much. And the last thing is, for these young people who stayed the whole time, we so appreciate you being here before and even being here now. Thank you so much. Thank you everyone for coming, and let's give Dr. Bobby McCumberland one more round of applause.